Hi, my name is Amyri Smith, and today I am doing a presentation on pharmacology, pharmacology presentation. When it comes to facts about medication, uh, did you know that when it comes to medication, you could do it's more than one alternative when it comes to medication. You can do therapy, you could do like self-care, self-help, you could do all different type of things. Medication is not the only answer when it comes to finding what's best for you, when it comes to what's the best fit for you. And did you also know that a lot of times, a lot of patients try different medications till they find that right item that's for them, until they find that right fit for them? Did you also know that, which is normal because you have to, it's like try and error. You're trying to find out what would best be a fit for you, what will work for you, and that's normal. Um, and did you also know that when it comes to like taking medication, it's always important to talk to your primary before you even make the decision to like get off the medication, just to be on the safe side. The first disorder, the first disorder I'm going to talk about is anxiety disorders. Anxiety disorders. So, for the primary medication for anxiety disorders is selective serotonin or reuptake inhibitors. And it's known for working by increasing the ability of serotonin, a neurotransmitter known to regulate mood, anxiety, and emotional well being. And also another primary medication for this disorder is serotonin norepinephrine reuptake inhibitors, and that targets like the serotonin and is known for like two neurotransmitters and mood regulation and emotional well-being. When it comes to secondary medication, a secondary medication would be biasprone, and biasprone is known for balancing the levels of dopamine and serotonin in your brain and substance that can help regulate mood. And like one last medication for this disorder is bezabines, and that's known for making the nervous system less active. An alternative intervention for anxiety disorders is cognitive behavior therapy, and they're known for like helping people learn how to identify and like change the destructive or disturbing thought patterns that have like a negative influence on their behavior and emotions. The next disorders I'm going to touch on is bipolar and mood disorders. When it comes to primary medication for these disorders, mood stabilizers are known to be used to treat symptoms of bipolar disorder and exhibit mainly the behaviors of manic and depressive episodes. A secondary medication for these disorders is anticonvulsants and is known for calming hyperactivity in the brain. And the last medication for this disorder is antipsychotic, and that is known to be used for like short-term or long-term effects as it relates to treatments for bipolar disorder, and is known to control psychotic symptoms such as hallucinations, delusions, and mania symptoms. Alternative intervention for bipolar and mood disorders is interpersonal and social rhythm therapy, and that's known for like to help focus on like daily routines, sleep patterns, and relationships to like reduce mood fluctuations. The next disorders I would like to touch on is personality disorders. The primary medication for personality disorders are antidepressants. Antidepressants are known to help if a client is exhibiting symptoms such as impulsive, irritability, or hopelessness. Secondary medication for disorders is mood stabilizers, and it's known to stabilize a neuroenvironment. And the last medication for this disorder is antipsychotics, and it's known as Risperidone. Risperidone is known to help like reduce aggression and paranoia. And an alternative intervention for this disorder is like dialectical behavior therapy, and that's known for like effective for emotional regulation and like distress tolerance. The next disorder I'm going to talk is schizophrenia spectrum disorders. When it comes to primary medication for this disorder is antipsychotics, and it's like heparidol, dopamine D2 receptor blockage. A secondary medication for the disorder is like atypical antipsychotics, Risperidone. Risperidone is known for like dopamine and like serotonin opposition. And the last medication for this disorder is claprazone. Claprazone is known for changing the chemicals brain patterns that are affected by the disorder, and is also known to like lower risk of suicide behavior in patients who has this disorder. Alternative interventions for this disorder is psychotherapy, and psychotherapy is like a way to help identify thought patterns and learning like positive ways to deal with stress. And another intervention is like social skills training, and that's known to help with communication and social interactions with others. The next disorder I'm going to touch bases on is trauma and adjustment disorders. The primary medication for this disorder is praxentine. Praxentine is known for working on the brain. Secondary medication is duclentine. Duclentine is known for treating anyone who has like depression or anxiety symptoms. And the last medication for this particular disorders are prazosin. Prazosin is known to help like reduce trauma related to like nightmares, insomnia for the individuals who have PTSD. An alternative intervention for this disorder is like mindless and stress reduction, and it's known to help clients for mindfulness meditation and like deep breath exercises to manage acute anxiety and irritability. When it comes to NSW ethical responsibilities to the broader society, I would advocate on the behalf of clients and social welfare to help to have more access in communities as pertains to mental health care. I would advocate on the behalf of clients as it pertains to pill mills and over medication. I would advocate on public disparities and address big pharma influence and justice in the system. I would support public participation and advocate on mental health in social settings. I would advocate as it relates to public emergencies. When it comes to a selected what I decide to focus on, the focus I decided to focus on is PTSD. And limitations for PTSD is for one, like medications is known for reducing symptoms, but doesn't address like the root cause of like what caused that trauma. Side effects from this is or from taking this medication will also be like side effects of taking medication is would be like nausea, fatigue, or like mood changes. Another thing when it comes to this medication is like taking medication for PTSD while also taking other medications can also cause more issues. When it comes to alternatives for this disorder, one alternative for this disorder would say is like trauma-focused cognitive behavior therapy. And that's known to like focus on reframing like negative thoughts, focus on developing positive coping skills, and also focus on like empowering clients. And like my next few slides are just my references of what I use to create this beautiful PowerPoint, the resources that I use to create this beautiful PowerPoint. And I just want to say thank you. Thank you for taking the time to listen to my video. Thank you for teaching me. I'm grateful for learning this class, grateful for this experience, and I hope you enjoy this video and hope you have a great night. Bye.